Behind every smart workforce investment, professional development program, grant proposal, or hiring strategy is one thing: data. But not just any data, labor market information. In this session, we'll explore how public tools, which are often overlooked and underused, can unlock powerful insights about job demand, wage trends, and flow of resources into key roles and industries. This kind of information is free, accessible, and essential to advancing economic justice in every state, every region, and every community, working to build a sustainable healthcare workforce. In this video, Rosendo Flores, labor market consultant with California's Employment Development Department, provides a comprehensive look at the tools and resources available through California's Labor Market Information Division. While the examples focus on California, the tools, insights, and methods shared are relevant in every U.S. state. Every state has its own labor market agency offering free, publicly available data on employment trends, wage ranges, industry projections, and more. These data are not just statistics, they are the foundation for decision-making around where resources go, which sectors are prioritized, and which roles, like community health workers, receive the investments needed to grow and sustain. Economic justice requires access to this kind of information. Without it, communities, especially those often left behind, are excluded from the conversations and decisions that shape funding, training programs, and job opportunities. Hi, I'm Christy McKenzie, founder and principal of Pivot First Consulting and Management. At Pivot First, we utilize these labor market tools and others like them as part of our research and workforce development advising. Labor market and employment data can be applied in helping clients refine staffing models, secure sustainable funding, or plan for future workforce needs. Labor market and employment data is critical for grounding decisions in real-world trends and advocating effectively for community workforce investments. Let's get started. Hello, and good morning, everyone, to the Community Health Work and Perimeter Workforce Capacity Building Collaborative Statewide Seminar 1. This seminar is going to be focused on public tools and resources to define community health worker demand. Okay, so without further delay, I'm going to introduce our speaker, Rosendo Flores. Rosendo Flores is a labor market consultant with the Employment Development Department and Labor Market Division. Rosendo has worked in employment training field for nearly 20 years and has been employed with the EDD since 2008. Prior to his current role as labor market consultant for the counties of Kern, Inyo, Mono, Kings, and Tulare, Rosendo has held various roles in America's Job Centers for California system, including Employment Program Manager for EDD, Career Counselor, assisting job seekers, and Business Services Representatives, assisting employers with employment needs. So let's give a warm welcome to Rosendo, and I will turn things over to you.
Thank you so much. Thank you so much for the wonderful introduction. Good morning, everyone. I'm happy to be here. And as she mentioned, my name is Rosendo Flores, a labor market consultant for the Employment Development Department's Labor Market Information Division. And, I mentioned I'm the consultant for Kern, Inyo, Mono, Kings, and Tulare. So as such, throughout the state of California, there are consultants responsible for every county in the state. So I will show you a little later in the presentation where to access a contact list for the state in case you're interested in consulting with one of us. You may also contact me and I can get you in touch with a consultant responsible in your area. So today I was asked to join you and talk to you a little bit about Labor Market Information Division and services and products that we have available to you, to everyone that has access to the internet, basically. A lot of the tools and the products that I will cover today are available on our website, and I hope they are helpful to you. Next slide, please. So just briefly, Labor Market Information Division is a division within the Employment Development Department. Historically, Employment Development Department has been known as the Unemployment Department. Unemployment is a department within the Employment Development Department, such as Labor Market Information Division is as well. In today's presentation, we want to cover some tools and some products, as I mentioned. We will review monthly labor force and industry employment data. We will talk a little bit about the standard occupational code for community health worker, which is the focus of your group here today, and employment projections. We will also take a look at some wages data. And if we have time at the end, we will review our website and possibly do a live demonstration. Next slide, please. So the Labor Market Information Division is the official source of labor market information for the state of California. Every state has an entity that provides the labor market information in those states. And in California, it's EDD's, or the Employment Development Department's Labor Market Information Division. Our department provides information to help folks understand the economy in local areas and at the state level. We collect, we analyze, and publish statistical data. So a lot of the products that you're going to hear about today, or data sources, are highly statistical models in which a lot of the data is gathered via surveys, such as the labor force, industries or jobs, occupations, and employment projections. For those of you that may not be familiar with our website, I have added the website here at the top of this slide. So labormarketinfo.edd.ca.gov is our website. It's fairly straightforward and pretty easy to navigate. I will say this, that there are many ways to get to one data set. And today I will attempt to show you with images of our website to access these tools and products the easiest and perhaps the fastest way. As you can see on our website, the data is broken down by major subjects, such as LMI by customer, LMI by subject, and by geography. Next slide, please.
Excuse me, Rosendo. We have
Yes.
a question in the chat.
Sure.
Did you want to answer questions during the presentation or wait till you're done?
That works for me. I can certainly address it now.
Okay, one of the questions is, what is the relationship between DIR and EDD? We have been talking about apprenticeships with some DIR reps.
Sure. So the Department of Industrial Relations is another department within the state of California. We do not work directly with the Department of Industrial Relations. I am familiar with the apprenticeship standards department that they have. I believe they do use our data when it comes to the curriculum building of their apprenticeship programs. I hope that answered the question. Yes, we're going to start today with talking about one of our main roles, or one of the data sets that we provide on a monthly basis, and that's the monthly data release. Some of you may be familiar with it. I think I saw in the survey there are some folks from Workforce Investment Board, so I'm sure you probably are familiar with these data sets. Next slide, please. And we will start with an image here of one of the documents that's released. And we release this data on the third Friday of every month. And the data that is released is labor force data and industry employment data for the previous month. Here on this screen, you see an image for Tulare County. And at the very top, we have a very brief narrative summary. This whole sheet actually just provides a summary of what occurred during that month in the labor force and in the industry employment. At the top, we see that we have a narrative telling us what occurred with the unemployment rate during that month as it relates to the prior month and also the previous year. In the middle of this page, we see a graph that shows us visually what has occurred with the unemployment rate for 2 years or 24 months. Here on this particular graph, we see that the unemployment rate was at a rather higher level at the beginning, so dating back to October 20th, and it has steadily decreased as we're getting closer towards September of 22 last year. And the bottom portion, the bottom table of this sheet, we see a summary of industry employment, or in other words, of jobs. This is broken down by major industries. So you may see an industry labeled as farm or trade, transportation, and utilities. The data on the table at the bottom gives us the job numbers or the count of jobs for that month as it compares to the prior month and also to the prior year. Next slide, please. This slide here shows us two tables, and it's a detailed data sheet that supports the previous page or the previous sheet that we showed. The yellow table at the top shows us the labor force information. It breaks down the labor force for that particular area. In the previous slide, we saw that it was a basic summary. This sheet, this table here gives us details with what occurred in the labor force. So it gives us the size of the labor force for the area. It gives us the number of individuals reported being employed, and also the number of individuals reported being unemployed, and with the corresponding unemployment rate as it compares also to California and to the nation. The bottom table, the table in blue, we see a breakdown of the jobs or of the industry employment, and we have more detail in this table. For example, we see trade, transportation, and utilities. Well, underneath trade, transportation, and utilities, we see subsectors such as wholesale trade and retail trade. That allows us to see more detail in terms of the change in jobs in that month or in that year, and we can pinpoint in any area where those change of jobs occurred. Next slide, please. Next, we're going to move forward with looking at some of our tools. And what we've done is we are trying to focus on the community health worker occupation. And that's how I will display these tools and the data sets moving forward. Next slide, please. So the community health worker occupation is an occupation that has been identified by a federal statistical standard. It's called Standard Occupational Classification, or SOC system, if you will. It's used by federal agencies to classify workers into occupational categories. And there are about 867 detailed occupations with their definitions. Here on this slide, we see that community health workers occupation code is 21-1094 with a description of that occupation, which most of you should or probably familiar with. Next slide, please. And we are going to look at our employment projections as they relate to the community health worker. But first, I want to show you screenshots of our website on how to access these projections. Next slide, please. And these projections are estimates of jobs within an industry or an occupation over a period resulting from industry growth, technological changes, and other factors. We have two sets of projections. There's a short-term projection of 2 years that is available for the state of California, and there are long-term 10-year projections that are available for local areas. And these projections are revised annually to incorporate any economic changes that may have occurred. And currently, we are working with the 2018 to 2028 employment projections. And later this year, we will be releasing our new set of projections with 2020 to 2030 years of projections. Next slide, please. On our homepage, on our website, in the very center under LMI by subject, there is a link for employment projections. So as we select employment projections, next slide, please, we see that the page that appears is our employment projections page, where we are able to select a specific area. In this case, in the red circle, or we see Visalia, MSA, or Tulare County. When we pre-select this area, several charts or several tables will appear. Next slide, please. And in this slide, we see two tables that will display the top being the top 10 occupations with the most job openings, and the bottom table being the fastest growing occupations. In the red, we see that there's a filter available. This filter has not been set. It is designed to enter a minimum occupation. So in this case, no minimum level of education. In this case, no level of education has been selected. Thus, we're seeing all-inclusive occupations in these two tables. But we can certainly select a bachelor's degree, for example, or training, technical training, and these two tables will filter and display those top 10 occupations with the most job openings and the top 10 fastest growing occupations as well. We may not always find the occupation that we're looking for in these two tables. So on the next slide, please. We will see an option to select the occupational projections for any area within the state of California, or also for the state of California. As you can see in the top red box, there's a link identified as long-term projections, 10 years. And the occupational projections data sets or links can be accessed on the right-hand side, on the right column in the red box there. And next slide, please. And on this slide, we have an image of, I believe, this is the projections for Riverside and San Bernardino counties. And I will attempt to explain the columns and the data in this sheet here. It's a very long document, if you will. It contains all of the occupations listed for this county. And in this case, in yellow, we see the community health workers occupation. And I will work my way from left to right as we move in the row of community health workers. We see that the SOC code, or the occupational code, is 21-1094. And this sheet is broken down by major occupational groups. So 21, if you look towards the top of the table in bold, we see a major group titled Community and Social Service Occupations. So therefore, under this group, we have all of the occupations that fall under it. In the next column, besides the title, we see base year employment estimates. Looking down at community health workers, we see that an estimated 450 community health workers were employed in 2018 in Riverside and San Bernardino counties. A projected year estimate was listed at 520. And keep in mind, the projections is collaborative between the Bureau of Labor Statistics and the State Labor Market Information Division, and the methodology that is used to create these projections. The numeric change between this projection was listed as 70, but the methodology used also incorporates other factors such as exits and transfers. So individuals perhaps that are exiting an occupation, retiring, if you will, and also transfers, individuals that may transfer into the occupation or out. In the red, surrounding the red, we see in yellow 620 total projected community health worker occupations in Riverside and San Bernardino counties for that 10-year span. On this sheet, we also have some wages information, but we are going to talk about wages on the next few slides. So we'll talk about that hereafter. Next slide, please. In this slide, we see a comprehensive table of projections for community health workers in some counties that you may represent. So Alameda and Contra Costa counties, Ventura County, Riverside and San Bernardino counties, Orange County, and San Diego County. In red, we see the total job openings for those specific areas. And these are the estimated projections or projected jobs within that 10-year span. Next slide, please. Before we move forward, I believe there may be some questions. Did we want to address those now, or should we move on?
I had a real quick question. Can you hear me?
Yes.
Oh, thank you. Thank you, Rosendo. I had a question because with the hiring, this is one field where there was a significant number of short-term hires. How did that
Okay.
get captured? And unlike other positions, there was
Mhm.
such a surge of hiring. Those were
Mhm.
very short term. So how does that get reflected and is it represented accurately?
One of the things to keep in mind is these are estimates, and there is a methodology that is used that was created by the Bureau of Labor Statistics informing these projections. So the way the methodology could be a whole seminar in itself, apart from this, but briefly, they look at historical trends in an occupation, and thereby applying the method or whether it be an algorithm or whatnot to establish a projected number within a given time frame. We saw some exits and we saw some transfers. So that is a fairly new model that was implemented by the Bureau of Labor Statistics. Briefly, the old model was rather dated, in which the understanding was that individuals would enter an occupation, work for 30 years, and retire from that
Right.
occupation. But we know that's not true. We know that individuals transfer. We know that individuals go from one occupation to another. That's more of a modern time type of a transfer in a job. To answer your question, there really is no way to identify a short-term employment or long-term. The way that the methodology is applied, it's applied throughout every occupation and throughout all of the projections.
Thank you.
Next, we can review the occupational wages. We saw some wages in the previous spreadsheet or the projections, but next slide, please. The wages can also be accessed on our homepage with a link identified as wages under LMI by subject. And in the wages page, there are several different types of wages that's provided, but the wages that we are interested in showing and helping you identify for community health workers is the Occupational Employment and Wage Statistics Program. And this program produces employment and wages estimates for over 800 occupations. And one thing to keep in mind, this data set is gathered by an employer survey. It's an employer survey conducted by us. From my understanding, it is not a mandatory survey, but we are really pushing hard to make it mandatory so that we can provide a more comprehensive view or detailed data sheet for wages and employment estimates for the wages data set. If you happen to be an employer and you're sitting in this seminar today, we highly encourage you, if and when you do receive a survey, to help us complete the survey so that we can have a full comprehensive data set for wages and employment. Next slide, please. The table for wages, as we can see here, is broken down by area, and it also shows us that wages are available for the first quarter of every year. Currently, our most recent is for the first quarter of 2022, in which I've selected, I believe, San Diego. Next slide, please. Yes, we see San Diego's wages data set, in which I've highlighted the community health worker as well. It looks very familiar to the projections spreadsheet, if you will, with a little bit different data included. We see that this sheet is also broken down by major occupational group, but it contains wages data. We see that the mean hourly wage for community health workers in San Diego County was $25.07. There's a mean annual wage, and towards the right-hand side of this table, we see the 25th, 50th, and 75th percentile. The 50th percentile being the median, which is a very common data point that we often use to show the middle ground of wages for a particular occupation, in this case being $23.19 as a median hourly wage for community health workers in San Diego County. Next, we're going to talk about a rather unique tool or a database. This is an employer database that we provide on our website for folks to use for any purpose that they may have. Mostly have heard of job seekers using this, career counselors helping individuals look for employers. If there are employer outreach workers This is definitely a great tool to use. From our homepage, if we select the link LMI by customer, and on the second page, we select Find Local Employers link, we can access the database. This database is a database that's created by, we work with a third party who gathers employer information for the nation, actually, and they provide data to the states. There are 4 ways to search for employers, and today I'm showing the example of searching for employers by occupation. Next slide, please. I've selected Alameda County as an example, as you see in blue, and at the bottom of the screen, we see community health worker. Next slide, please. When we select a community health worker in Alameda, we see a list of industries that employ community health workers. So as you can see the numbers in the middle of this page, for example, the top being 1,641 employers listed under individual and family services. Some folks has referred to this as the hidden job market, if you will. So if you are working with a job seeker looking for a job in community health worker, this is a great place to start to identify employers. Next slide, please. I've selected the first entry, and we see in red that there's a list here of 1,641 employers with their locations. And what's neat about this tool is that it gives us additional information on these employers. In this case, we have an address, we have a phone number, not only any phone number, we actually have the contact number to the owner of this employer. We also have a website, which is a great way to access and do our own research and perhaps see if they're hiring on their website. As you can imagine, this is a really neat database and tool that we can use for job seekers, for business outreach specialists or whatnot. And I know I'm on a time crunch here, so I'm going to briefly talk about our occupational guides, and this will sum everything up from what we've discussed today. The occupational guides is a comprehensive guide that includes information on various occupations, including the job descriptions, tasks and skills, working conditions, any type of education that may be needed or required, any licensing. And we can access this tool by selecting LMI by customer and California occupational guides on our website. Next slide, please. The guides are fairly new. They've been updated. They're interactive. And so to launch the guide on our occupationals guide, there's a link at the bottom, launch the California occupational guide. And what I did here is I've pre-entered community health worker as a search. And we see in red here, these are the various data points in the guides. Currently, you are in the occupation profile page where we see skills that are needed by the individual as a community health worker. We also see task statements or job descriptions that an individual needs to do or does as a community health worker. Now, this data is brought in to this website from the Employment and Administration website called ONET Online. If you're not familiar, it is a really useful website to research occupations at the national level. We have job market data in the red there. We have different topics. We can see job market data, entry-level requirements. We have education providers. So the education providers link will show us any type of education providers in a selected area that may teach or provide training for occupational health workers. Lastly, again, this is our homepage. And I mentioned that there are about 20 to 21 other consultants such as myself in the state of California. And to access our contact list, you can do so on the lower right-hand side of our website below LMI by geography. You can't see it here on this page, but below there is a link identified as Contact LMI. And there you will see a breakdown of consultants with their respective areas of responsibility. And this is my contact information in case you are interested in just contacting me for further information, or if you can get a hold of a consultant in your area, feel free to email me. Email works best. If you have any follow-up questions, we can certainly schedule a time to meet. And with that, I give it back to you.
Thank you so much, Rosendo. What a wealth of information, both for employers and community health workers and promotores individually. We have about 5 minutes for
Okay.
questions, and I'm going to let Leandra lead that. We're going to start with the questions from the chat, which are coming in,
Sure. Mhm.
and then we'll go to Carlina.
Okay, so the first question I have is from Kitty. It says, do these projections take into account the increase in CHW funding through Medi-Cal over the next 5 years?
As mentioned before, the projections it's a standard method of producing the projections. Each occupation is not looked at individually in terms of additional funding, or we look at economic factors in specific areas. It's a method that has to be followed at the state level for producing these projections. The way that we can, and most of us consultants, what we do when it comes to these projections is we provide input to the projections unit when we do know of certain scenarios such as the question posed. So if we are aware of additional funding in a certain occupation, we can certainly provide that information so that it is taken into consideration. So that's why it's important to have your consultant information available.
These next two questions have to do with data searching. The first one is from Michelle. What if, when you drill down to this data for your area, you don't see the 21-1094 represented all on the chart? And then the second question is, are there separate employment codes for patient navigators, care coordinator positions that might engage CHWs in more clinical capacities?
Sure. So all the data that is available. I mentioned that a lot of it is surveys. When you don't see an occupation listed, because I'm assuming it's probably someone from a smaller county. In other words, we may not have received a significant amount of responses from employers from that area to provide the data. So we have to keep employers' information confidential. And so we may not have received enough surveys in return so that we can display that data. I believe that answered the entire question. I think there was a second part.
Yeah, the second part again was, are there separate employment codes for patient navigators, care coordinator positions that might engage CHWs in more clinical capacities?
Potentially, I'm not sure, but what happens a lot is an occupation title may not be an official title that is used in the standard occupational code system. Therefore, it may be summarized or it may be included in a community health worker, for example. So it really depends what that occupation is titled in the actual standard occupational system. So we'd have to look to see if it's an official title.
And the last question in the chat was, assume that CHWPs engaged on a contractual basis, for example, stipends are not captured. And what are the implications in the context of AB5?
Wow, I'm not sure. That seems to be out of my scope, perhaps. Like I mentioned before, in terms of the projections, it would be the methodology that is followed. In terms of the wages, it would be the responses that we are receiving from employers to display the data for wages for community health workers.
Thanks so much. And then Carlina, we'll go to you with the question, and then we have a couple questions in the Q&A section.
Thanks, Rosendo, so much. This is super interesting and helpful. So one of the challenges with community health workers that was hinted at in the last question is there are so many different titles, CHWs, and there's not necessarily consistency, if I had to guess, in the SOCs that people are using. For example, one of the ones that was displayed in one of the charts was health education consultant or something to that effect. So I'm curious and I have this two-part question. And my first one, what folks on the line can do to ensure that folks are using a consistent labor classification code?
Yeah,
and just
sure.
a quick annotation to that. I think it's hard because folks may not see themselves represented, not unlike race and ethnicity data, right? But at the same time, you, in order to be counted, have to choose, which is hard,
Sure.
right?
Sure.
So can you say a little bit about that?
Yeah, so I think what's important, as I mentioned, a lot of this data is provided by the employer themselves, right? Like you mentioned. Number one is ensuring that the employer is working with the analyst that is contacting them in terms of that survey so that the occupation is identified correctly. The analysts from our department will ensure that they provide the information for the description of the job that they are talking about, in this case, community health worker. One of the things that I noticed when I was working on creating this presentation is that in our occupational guides, there were about 4 or 5 different titles that I had to select to summarize the community health worker. So you're absolutely correct in that there are other titles that are being used. But I think what's important is, as long as the data is being responded to, the surveys being responded to, and again, working closely with the analysts that they speak to so that they ensure that, one, they follow the job description accurately and identify the occupation as such, and two, that the wages data is reported and the employment count or the employment number is provided as well.
Got it. So work with your local person and then advocate with your employer if you're not the employer. And then can it be helpful to agree as a community of workers to use a consistent? Have you seen folks do that, to say, look, we're going to agree, we're all going to call ourselves this so that we get counted in the same way? Have you seen folks do that?
No. So what happens a lot is, because there's so many guides or federal guides or descriptions or whatnot. If I'm an employer and I want to call my worker secretary or whatever the case may be, that's my prerogative, if you will, right? I think that in the greater scheme of things, when the data is reported, if you are an employer in the survey cycle, if you will, because not all employers are surveyed, if you are an employer in the survey cycle, is to ensure that your job description meets the requirements of a specific title. And that's pretty much the best that we could do.
Super helpful. I'll cede so others can get questions in.
Sure.
Thanks.
So there are a couple of questions that are in the Q&A feature. Rosendo could definitely, if you can use that Q&A feature to just chat the questions back. What I'm doing too is copying and those answers to those questions, and we'll send that out in a follow-up to the attendees in the session. And I see Rosa has her hand up as well. I think she has one last question. She's had it up for a while.
Thank you. Thank you, everybody.
No
Rosendo, you're a little treasure of information that it's something that we don't oftentimes think about and integrate into our work. So thank you. Clarification, I think this is going to be more of our internal conversation, that there's a couple of things that you noted. The data is only as good as the information that you receive, and everyone has different interpretations. But I think we also need to think specific to the community health workers, because there was a rash of very short-term employment that may have resulted in higher wages and compensation, because we knew that it was going to be short-term. But then there's an impact also for those individuals, for agencies, community-based organizations on the unemployment side. So these are some subtleties that I think we just have to be really paying attention to, that could be for consideration and may change as we have more long-term funding. So I just want us to think about data is really useful and helpful. It also has gaps because it's only as good as information we provide. And then we have to take a deeper look at what is happening at the local level and really understanding that per each, even not even just county, but even funding, as someone had mentioned, what are the funding source requirements? So I just wanted to put it in perspective, just so that we're thinking a little broader as we're moving this whole effort forward. But thank you, Rosendo, it was very helpful.